Okay, so we have the case study for Mr. William Butch Wilka, who is experiencing some dementia symptoms. He's got a history of heart failure, COPD, hypertension, diabetes. His wife is currently reporting that he has some altered behaviors. He's becoming a little more confused. He's a little more agitated towards her. Some relevant data from the present problem also includes prior hospitalizations for the exacerbations of his heart failure. He's recently moved. He's in a long-term care facility now. These types of things are going to increase his confusion overall and exacerbate the dementia. Some things that are kind of positive for him socially, he's got a long-term partner. So his wife has been with him 51 years. He has 3 children, and all of them visit him pretty regularly, which gives him a good routine. He had a long history with his work as a salesman. He is not coming to terms well with the fact that he's in the long-term care facility. And he has recently been assigned a guardian, so his wife is making decisions for him. So according to ATI and the Alzheimer's Project, a lot of these things are gonna help contribute to keeping him on track with his dementia and keeping him grounded and improving his behaviors. And some of these things, like moving, is going to make those things a little worse. And since his short-term memory is not that great, he's going to keep forgetting and requires a lot of redirection.
As patient care begins, we get his vital signs. Temperature reads 99.8, pulse is 60, respiration 16, blood pressure 115/72, O2 saturations at 96% at room air. His pain assessment comes out to 4 out of 10 on the pain scale. The relevant vital signs that we have comes from the temperature of 99.8. According to Lippincott, this oral reading of 99 to 100.4 is classified as a low-grade fever, commonly caused by an infection or dehydration. The rest of his vitals, according to ATI 2023, fall within normal range. A PQRST assessment was also performed. P would record the influence of physical and emotional activities that may have caused the pain and any attempts the client has made to alleviate the pain. Q would interpret how the pain feels. R would record the regions of the body the pain is felt. S, severity, would obtain a numerical rating number from 0 to 10, which is 4. And T for time would record time of onset and frequency of his pain, according to Harding ETAF.
Okay, so after reviewing his mental status exam, we notice that he is found incontinent in his soaked pants. He's not really dressed appropriately. He walks with a shuffling gait, requires a walker. He is easily angered. He's emotionally labile. His thought content is preoccupied with his living situation. He always wants to leave. He's not he's not comfortable where he's at. He's hallucinating. He's seeing his friend Roger. He does not understand why he's at the facility. He has very poor insight. He's got poor judgment. He is eating excessively and forgets that he eats. His cognition, he's not very oriented to time or purpose. He has very poor short-term memory. And he was stating that he might want to walk into traffic, which is an indication of a suicidal statement. So according to Kristenman 2022, all of these things are abnormal on the mental status examination. A lot of these are gonna leave him as a danger to himself. He's gonna be a high fall risk, he's at risk for injuries, and he's going to require a lot of redirection and behavioral corrections with his hallucinating and the fact that he keeps wanting to leave. He's gonna also worsen his diabetes if he keeps overeating. So these are things that the nurse should pay attention to now that they've been found.
Okay, and then for his general assessment, we found that the relevant data includes the client looking calm and relaxed and resting comfortably. He had unlabored breathing with clear breath sounds in all fields. There was no presence of edema. His heart sounds were regular without murmurs or abnormal beats, and his capillary refill was less than 2 seconds. He was determined to be alert and oriented ×2. He is not oriented to time, date, or situation. He also experiences difficulties sleeping and wakes up several times throughout the night. He has normal active bowel sounds in all 4 quadrants. His abdomen is soft and non-tender. He voids without difficulty but does experience incontinence of urine. His skin is intact without any lesions or redness, but he is experiencing tenting. According to ATI, his calm and relaxed demeanor indicates that he has a low pain level and that he should not be experiencing discomfort. We also found indications that his heart failure and COPD should be well managed, indicated by his clear lung sounds and no presence of edema and normal cardiac sounds. His lack of quality sleep could be contributing to his neurological dysfunction, and it may be contributing to his current cognitive status. His soft, tender abdomen indicates that he's eating regularly while also having regular bowel movements. And tenting is typically an indication of dehydration, which this client could be experiencing due to a reduced intake of water from possibly wanting to avoid incontinence. And this could also be related to his cognitive dysfunction.
After taking a look at the lab results, basic metabolic panel, we get a sodium level that was 140, and his most recent was stable at 140 again. His potassium went from 3.4 to 3.5, which is a trend of improving. Glucose went from 225 to 182, which also indicates an improvement. And his creatinine went from 1.2 to 1.1, which just stayed stable within the ranges of normal levels. Sodium is a main electrolyte in the extracellular fluid, which controls the distribution of water and maintains normal fluid balance. His value could indicate that there is no fluid loss or dehydration. Potassium was slightly low in the beginning, which causes neuromuscular excitability or muscle weakness, but it's been improving, so we might not worry too much about that. And it is important for blood glucose levels not to rise too high. A blood glucose equal or greater to 200 is referred to as hyperglycemia, which his levels were above 200, but they improved going down to 182 through interventions that were implemented. And creatinine levels, they are the reliable indicator of kidney function, and they are stable.
And looking at the patient's complete blood counts, we see that the white blood cell count is increasing, which is a worsening sign. So the increase of the white blood cells indicates an infection according to the Capriati pathophysiology textbook. The value went from 5.8 to 6. The number is still within normal limits, but it should be monitored. The hemoglobin was also within normal limits and pretty stable, but there was a slight increase. The platelet count was normal, also a very slight increase. And then the other more relevant CBC value was the percentage of neutrophils. It increased, which is another sign of infection. So it should also be monitored. It is still within normal limits, but once again should be monitored in case it does increase even more. And then the number of bands, which is the young neutrophil count, it was stable. It stayed at 0%. And then looking at the urinalysis, the most relevant data would be that the white blood cell count did increase greatly from 0 to 4. And again, according to the Capriati pathophysiology textbook, that is an indicator of infection. There was a trace found of bacteria in the urine, which is another sign of infection. And then there was a trace of epithelial cells, which could be an indicator of a UTI or a kidney infection. And the other lab values were all stable. The color was yellow, which is normal. The urine was clear. The specific gravity increased a little bit. That number should also be monitored. It decreased a little bit, which could indicate some kidney damage. And there was no trace of protein, nitrites, leukocyte esterase, or the red blood cells in the urine, which is all normal and stable.
So we came up with a possible primary problem as being UTI due to the fact that there is white blood cells present in his urine analysis, and that could also indicate some bacterial infection that has migrated into his bloodstream, causing malfunctions in other body systems. So this could lead to his wife reporting changes in Butch's behavioral presentation, like confusion, aggression, and having episodes of incontinence. For the medical management, the care provider ordered a neuropsychiatric evaluation, and this is a comprehensive assessment that will diagnose his cognitive function, mood, and behavior. This would help identify any specific treatment that could address his issues, and maybe we can modify his medications or obtain a new order from the physician. The other order is a urine analysis, and this will help detect lab values that will help determine a possible UTI and the severity of it. And if there is a UTI present, antibiotics may be prescribed to help combat that bacterial infection and alleviate confusion that is associated with the UTI. Haloperidol is used as an antipsychotic medication that will help with the signs and symptoms of dementia. Lippincott states that haloperidol can reduce Butch's agitation and aggression. He also is given acetaminophen, which is an analgesic and antipyretic to help treat mild pain and fever. This would help Butch's mild pain that he's experiencing in his back and the elevated fever temperature. And he's also given insulin glargine. This is going to help control his blood sugar levels and maintain his blood sugar levels, making sure that it stays below 200. He's also prescribes Memantine, which is a medication that helps slows the progression of dementia. So the increase in Memantine dosage may lead to improved cognitive function and behavior in Butch, and potentially reducing his confusion and agitation. He's given Donepezil, which is also for dementia, and that will help slow his progression of dementia and hopefully alleviate some of the symptoms that he's experiencing and improve his behavioral disturbances. He's also giving Trazodone, thank you. That's supposed to help for treat major depressive disorder, but specifically for him, his would be addressing his insomnia, and this will provide good quality of sleep, reducing his nighttime agitation, and improve his overall behavior and mood. Some nursing interventions. We want to prioritize safety precautions being number one, due to the fact that Butch shows signs of progressing dementia with symptoms of confusion and hallucination, and safety precautions will prevent falls, injury, and harm to himself and others. So the nurse could frequently monitor Butch, making sure he's okay, making sure his environment's free from any hazards, and just assist him with any daily activities. Second on our list is timely medication management. Since Butch is experiencing symptoms of hallucination, aggression, and confusion and pain, ensuring Butch receives his medication can help provide comfort and mood stability. So for a nurse, they would probably administer Butch's medication in timely order, and they would evaluate the effectiveness of these medications and address them to the HCP if something is abnormal. And third, we have collaborative care. This would help address Butch's conditions by requiring a team of other healthcare professionals to provide a holistic approach of patient care. So the nurse would probably incorporate his primary health provider, a dietitian, behavioral therapist, and an occupational therapist to coordinate the proper care that is needed for him.
Okay, and then for some psychosocial nursing interventions, we came up with emotional support for the client and family members, and also promoting a relaxing sleep environment, and then lastly, promoting the client's active participation in ADLs. In an article published by Kurz on psychosocial priorities in dementia patients, they talked about how important it is to be emotionally supportive to family and a client experiencing a new situation like this one. Butch is transitioning to a new phase of his life, and his family is also experiencing that new transition, so being emotionally supportive can really help this family transition in a more peaceful and relaxed way. And then creating a sleep schedule for the client that involves relaxing methods such as like music therapy or aromatherapy can help him to sleep through the night, which may improve his cognitive function. And then promoting the client's participation in ADLs will help him to maintain physical function and also promote independence in this client as much as possible.
We have some education priority for this client and anyone involved, and that would be monitoring glucose. As a person with dementia, it can be hard to forget to manage blood glucose and be checked to make sure it doesn't fall over 200. We would want them to take their prescribed medication as ordered. Again, due to confusion, it can be challenging to take these medications in a timely manner, so caretakers and family members can help reminding him. Non-pharmacological pain management can also help. This uses physical approaches to improve comfort, use distractions such as music, ambulation, and deep breathing. It is important to keep a routine that is the same every day. As a person with dementia can become disoriented, it can help them orient better to the present time. Using notes or a calendar can also help with memory problems. They tend to be very forgetful, and just little notes can help with certain tasks and thoughts. Maintaining a calm environment is helpful for dementia people to help handle their feelings. Again, something like playing music can help them from being overstimulated by loud noises. Keeping an environment clutter-free is important for a safe home in order to prevent fall risks that would threaten their safety, causing any injuries. Daily exercise. It is important to keep muscle tone and balance and prevent limited activities. that could cause lung infections or bed sores. And then lastly, join a support group. Patients with dementia typically lose interest in things they used to once enjoy. And being able to relate to others living with this illness can provide a new perspective and different ways to help cope. And all of this came from a reference of ATI 2021.
Perfect.
Thank you.